Hello everyone, I am Beatrice. In today's video, we'll look at anemia. This is part of hematology review. Particularly, we'll be looking at a type of anemia known as iron deficiency anemia because it's the most common type of anemia. We'll be looking at the causes and pathophysiology, the signs and symptoms, how to diagnose iron deficiency anemia, and also the treatment option, including nursing intervention and patient teaching. And before the end of this video, we'll look at some NCLEX-style questions that will test your knowledge in a way to help you understand the topic better, so to reinforce your understanding of the topic. So if you are ready for today's video, let's dive in. Before we look at iron deficiency anemia, which is a type of anemia, let's understand what anemia is. Now, anemia has to do with a decrease in red blood cells, or we say a decrease in healthy red blood cells. The pathophysiology of anemia is simple and straightforward. We are saying that in anemia there is decrease in red blood cells. And we know that red blood cells are loaded with protein molecules known as hemoglobin. And hemoglobin is the one that transports oxygen. So oxygen needs to bind to it in order to be transported around the body. And carbon dioxide can also be removed through that process. So hemoglobin is loaded with about 4 heme molecules. Each of these heme molecules bind to oxygen. So it means the hemoglobin is able to bind to 4 oxygen molecules. So if the red blood cells are circulating are low, hemoglobin will also be low. And that's also low oxygen in the body, in the tissues, and the cells. With this patient is going to manifest general signs and symptoms that is unique to all anemias, which include fatigue. Of course, they'll be tired. And then pallor due to that decreased hemoglobin concentration. We have dyspnea, shortness of breath. These are compensatory mechanisms. Tachycardia, increased heart rate because the heart is going to compensate by trying to pump more blood to increase oxygen saturation. And then we have dizziness, low oxygen. Of course, the patient is going to feel dizzy. And then cold intolerance, that's hypothermia. And this will happen when the red blood cells are circulating in the body are low. It's going to decrease the ability of the body to produce energy and to produce heat. Now let's look at iron deficiency anemia. Iron deficiency anemia, as the name goes, is an anemia that is caused by deficiency of iron. Now, I mentioned also before that iron deficiency anemia is the most common type of anemia. Now, I also mentioned before that RBCs, or the red blood cells, are loaded with a protein molecule known as hemoglobin. And we say there are 4 heme molecules that binds to oxygen. But at the center of that heme molecule is iron. So the body uses iron to make hemoglobin. And the implication of that is that when there is decreased level of iron, there's going to be decreased level of hemoglobin, invariably a decreased level of oxygen. Now, what are the causes of iron deficiency anemia? There are 3 broad causes. One is poor intake. It can be due to poor iron in the diet, if you're not taking enough iron in your meal, or in pregnancy where there's increased demand for iron. And then in infancy, in children, they are at risk of iron deficiency anemia. And then vegetarian diet, they stand the risk of developing iron deficiency anemia. And then the second broad cause is bleeding or blood loss. Anything that causes someone to lose blood, hemorrhage, can cause iron deficiency anemia because when you are losing blood, you are losing red blood cells. This can happen in cases like trauma, like an accident, road traffic accident, even in surgery where somebody loses a lot of blood. Then we have menstrual loss. During menstruation, women that menstruate every month, they stand the risk of iron deficiency anemia. And then any gastrointestinal bleed, hemorrhoids, even peptic ulcer disease. Then we have the third broad cause, which is poor iron absorption, that's malabsorption of iron. This can happen in some conditions where the body is not able to properly utilize iron, or in some surgical procedures. So some conditions like celiac disease, then surgical procedure like gastric bypass, intestinal surgery, any of those surgery can affect the absorption of iron. Now let's look at how to diagnose iron deficiency anemia. The first one is complete blood count. So they check the hemoglobin, they can check the hematocrit or packed cell volume. They will check mean corpuscular volume, MCV, mean corpuscular hemoglobin concentration. All of this here will be decreased in iron deficiency anemia. Then for mean corpuscular volume, it has to do with how fat the red blood cells are. So the size of the red blood cells, the volume of the red blood cells. So the normal range is 80 to 100 femtoliters. So that's what we call normocytic, meaning the normal size. But if it's less than 80, it will be microcytic. If it is greater than 100, it will be macrocytic. Then for the mean corpuscular hemoglobin concentration, it has to do with the color of hemoglobin or the concentration of hemoglobin in the red blood cells. The normal range is 32 to 37 gram per deciliter. So that's what we call normochromic. That means it's normal. But if it's less than 32, we are looking at hypochromic. If it is greater than 37, we are looking at hyperchromic. Another one is true iron studies. So for this one, there will be decreased ferritin, and there will be decreased serum iron, and also decreased transferrin. Now, this transferrin and ferritin, they are transporters of iron. So they are able to bind to iron and transport iron. The most accurate is actually ferritin, because ferritin helps also in storage of iron. Now, for the total iron binding capacity, which is what we call TIBC, it will be increased. And that's because of a compensatory mechanism by the liver to produce a binding sites, like searching for more sites, so that it's thinking that, oh, iron, there's not enough iron, maybe because there's not enough binding sites. So it increases the binding site, especially for transferrin. So when it does that, there's going to be what we call increased total iron binding capacity. Now let's look at the symptoms of iron deficiency anemia. I'm going to mention symptoms that are unique to iron deficiency anemia in addition to the general symptoms of anemia. The first one is that for the characteristics of iron deficiency anemia, it will be microcytic. That means it's going to be less than 80 femtoliters. So it means the red blood cells are going to be smaller in size. And it will be hypochromic. That means it will be less than 32 gram per deciliter. That means the hemoglobin concentration will be low. And that's why when they examine it under a microscope, it will be very pale. Then we have glossitis, that's inflammation of the tongue, red beefy tongue, and angular cheilitis, so there will be ulcers at the side of the mouth. Then another one is brittle spoon-shapedness, especially in chronic iron deficiency anemia. That's what we call koilonychia. And then we have pica, that's craving for non-food items. You can see the person craving for clay, ice, different things that are not edible. That's why you see in pregnant women, if they are deficient of iron, the sign is when you see them craving for things. They can even crave for sand. They can crave for, when let's say rain fall, they begin to crave for some weird smells. Remember, when we're looking at the causes of anemia, one of them is due to poor intake or increased demand for iron, especially like in pregnancy due to fetal development. Then we have neurological changes. This can also manifest in iron deficiency anemia, though more unique to pernicious anemia. I'll look at that in another video. So these neurological changes, the patient can manifest some confusion, depression, and all that. How do we manage iron deficiency anemia, including also intervention and teaching? Then we're going to treat the cause. So what's causing? Is it poor intake? Then the patient should take in more iron. Is it bleeding? We should stop that bleeding. And then if it's malabsorption, it should be treated. Then oral supplementation for iron deficiency anemia, it can be managed with oral supplementation of iron. They're like things like ferrous sulfate, ferrous gluconate. So a patient can be given this. But we need to teach the patient that when they are taking oral iron, it should be taken on an empty stomach, because iron is best absorbed on an empty stomach. And then they should take it with vitamin C, because vitamin C helps in absorption of iron. An example can be taking it with orange juice. And then they should avoid taking anything iron with milk, tea, coffee, even antacid. They can decrease the absorption of iron. I mentioned it, the antacid, in one of my videos, that it interacts with a lot of medication, including iron. So when a patient is taking antacid, they should wait a period of 2-hour window before they take iron. So it should not be taken together. Generally, when a patient is taking antacid, they should take it separately from other medication within 2 hours window. Another thing is, if they are taking liquid iron, they should take it with a straw. The reason, because iron can stain the teeth, so they should take it with a straw, and immediately they are done, they should brush their teeth. Then it's also important that we teach the patient to know that iron, when you are taking iron supplement, you can have a normal dark black stool. It's normal. So they should not panic when they see that their stool is dark, because they are taking iron. Then constipation is a side effect of iron, so patients should be encouraged to drink a lot of fluids. And then IV iron can be administered. And finally, blood transfusion in severe cases, they may have to transfuse the person. If the patient has lost so much blood, they can transfuse the patient. Now, finally, we need to teach patients iron sources where they can get iron to supplement in their diet and to increase their iron intake. They can get it from red meat, poultry like chicken. They can get it from fish, cereals, nuts, even potatoes, oysters. They can get it from tuna. Now let's look at some NCLEX-style questions that will test your knowledge on iron deficiency anemia. The first question: A nurse reviews a client's complete blood count and notes red blood cells that are small in size and pale in color. These findings are characteristics of which type of anemia? A. Iron deficiency anemia. B. Pernicious anemia. C. Sickle cell anemia. D. Aplastic anemia. The correct answer will be iron deficiency anemia. We know that iron deficiency anemia produces microcytic, that's small size RBCs, and hypochromic, that's pale red blood cells, due to reduced hemoglobin content. Question 2. A client with iron deficiency anemia is prescribed oral ferrous sulfate. Which instruction should the nurse give to maximize absorption? A. Take with milk to protect the stomach. B. Take with orange juice on an empty stomach. C. Take with a high fiber breakfast. And D. Take with a calcium supplement. The best answer will be B. Take with orange juice on an empty stomach. Every other one can interfere with iron absorption. Question 3. A nurse is reviewing lab results for a client suspected of having iron deficiency anemia. Which finding is most consistent with this diagnosis? A. Increased serum ferritin. B. Low MCV, low MCHC. C. High serum iron. And D. Low total iron binding capacity, TIBC. The best answer will be B. Low MCV, low MCHC. We know that iron deficiency anemia is microcytic, so of course it's going to be low MCV, and hypochromic, that will be low MCHC. Question 4. A nurse is caring for a pregnant client with iron deficiency anemia. Which statement by the client indicates a need for further teaching? A. I will include lean red meat in my diet. B. I should take my iron supplement with water after meals. C. If I get constipated, I will increase my fiber and fluids. D. I will continue taking my iron for several months even if I feel better. The best answer will be B. I should take my iron supplement with water after meals. This shows that the patient needs further teaching. The patient does not understand, because iron is best absorbed on an empty stomach with vitamin C rich food like juice. Question 5. A nurse suspects a client has chronic iron deficiency. Which of the following findings will support this suspicion? Select all that apply. A. Spoon-shaped nails. B. Glossitis. C. Pica. D. Jaundice. E. Pale conjunctiva. The best answer will be A, B, C, and E. There are spoon-shaped nails, what we call cornicea, glossitis, pica, and pallor. These are characteristics of iron deficiency anemia. Jaundice is more common in hemolytic anemia due to excessive breakdown of red blood cells. Question 6. The nurse is caring for a client with iron deficiency anemia who report dark black stools after starting oral iron. Which action should the nurse take? A. Stop the medication and notify the provider. B. Reassure the client that this is an expected side effect. C. Advise the client to increase fluid intake. And D. Recommend taking iron with milk. The best answer will be B. Reassure the client that this is an expected side effect. So we know that oral iron can cause dark stool due to unabsorbed iron. So this is harmless, is expected in a patient taking oral iron. The last question, question 7. The nurse is planning care for a client with severe iron deficiency anemia. Which nursing diagnosis is the priority? A. Activity intolerance related to decreased oxygen carrying capacity. B. Risk for infection related to decreased white blood cell count. C. Disturbed body image related to pallor. And D. Impaired swallowing related to glossitis. So the best answer will be A. Activity intolerance related to decreased oxygen carrying capacity. We know that in a patient that has iron deficiency anemia, they suffer fatigue, weakness, tiredness, and that's because of that decreased oxygen carrying capacity. So they are not able to tolerate activities. So this would be a priority to be addressed. So that wraps up today's topic on iron deficiency anemia. If you find this video helpful, please like, share, leave your comment, and subscribe for more educational videos. Thanks for watching.